Well, we send them home with a summer workout plan and a winter workout plan so that hopefully they follow those plans and come in with a fitness level already so that they're not shocked into college lacrosse training. We make sure that we warm up our muscles before our workouts. We do a dynamic warm up in the beginning of practice and make sure that we do some stretching at the end of practice. We also recommend ice baths to reduce soreness and certainly utilize our athletic trainers to help with the injury preventions as well, as our strength coach who does some strength training to prevent injuries.
There are several benefits to strength training, actually, but I think for lacrosse the most functional piece is probably the explosiveness you can gain from more powerful muscles, building muscle strength, muscle size, explosiveness, lateral, linear, defensively stopping attackers from getting through and offensively dodging attackers, going to cage. So I think, endurance wise, depending on what type of lifting you do, it can help with muscular endurance. So speed, strength, power are all things that will equate to better lacrosse players on the field.
Obviously it depends on what muscle it is and what the grade of the strain is, because there's a difference between grade 1, grade 2, and grade 3. 1 being the least traumatic and 3 being possibly a complete rupture. So what I would do is start off with making sure to do things in pain-free ranges of motion, and then from there work on strength and proprioception. I don't believe in using ice for chronic injuries, such as people that have had low back pain for a long time, because I think that people just use the ice to numb the pain and then it goes away and they don't think about it, and then the next day their pain comes back and they just keep putting ice on it and they don't do anything to actually make it better. I believe in ice for acute pain, such as like a recent ankle sprain or surgery, as a way of for a way to help them deal with the pain, but I don't believe that the ice is helping to heal them at all. A strain happens in muscles and muscle tendons, whereas a sprain happens in ligaments. A ligament is something that attaches bone to bone, like your MCL or your LCL ligaments, whereas a tendon attaches muscle to bone, such as your Achilles tendon.
So we often get asked, why do we do the 1 mile, the 3 mile, or the 5 mile runs in our preseason? The 1 mile run is difficult both mentally and physically, because it is almost like the athletes are putting everything out there all at one time. The 5 mile is mostly mental training. They think, why do I need to run 5 miles? I'll never run 5 straight miles in a game. But it's one of those things that if you can mentally get yourself to run and finish 5 miles, something that you've never done before, hopefully when you get into a game and it goes into overtime or another overtime and another overtime, mentally you know that if you can endure the 5 mile run, you can endure another 3-minute overtime and it's not an issue. Most of our preseason runs, we change kind of day to day just so that we hit different muscles. We train for endurance so that it does make our shorter distances, they get faster doing that. We implement a lot of interval training, hills. Again, all of that will increase our speed and make us faster and have more stamina in the long run for games.
Beat FIT on 3, 1, 2, 3.
Beat FIT